So what is a tendon and what is the function of it in the joint of the shoulder? Tendons have a number of different functions, but there's two we're primarily going to focus on. The first one is the attachment of muscles to bone. Any muscle that you have in your body is connected to a tendon, which attaches the muscle to the bone. The second thing is the transfer of forces. Anytime you move a muscle, force is generated and has to be absorbed by something. But how exactly does this work? The first thing is your brain creates a little electrical current and send those electrical currents down your nervous system. When these nerves reach the muscle, they actually generate a small electric shock. From this electric shock, it actually causes the muscles to contract. And when the muscles contract, that's what allows you to move your arm. When you contract that muscle to move your arm, force is generated from that particular muscle. And when force is generated, it has to be passed down through the tendons and its straight fibers and to be absorbed by the bone. Remember, anytime force is generated, it has to be absorbed by something in the body. But what actually happens when you have a small little tear occur in the tendon? The best way to think about it is a rope that has a weight attached to it on a pulley. When you're pulling the rope, the 20 pounds of force is distributed through the full thickness of the rope. But if you cut 20 or 30% of that rope, when you move it up and down the pulley, that 20 pounds of force is going through a smaller surface area of the rope, which means there's a lot more stress going through a smaller piece of the rope. And that's exactly what happens in your tendon when there's a partial tear. A lot more force is going through a smaller surface area. And the more you move it, the more stress that goes through it over time, which leads to that tear progressing and getting bigger if left untreated.